Hi YouTube, this is Yoti1985. This video, which is going to be my fourth, is going to be a video about the symptoms that I experienced when I first got diagnosed with my ectopic pregnancy. Now, I'm not going to go through the story again, but I do want to go ahead and go into detail with the symptoms I had. Because when I had my ectopic pregnancy, I did Google a lot of the symptoms, but I really wanted to have that personal input, like I wanted to speak to somebody who had been through an ectopic pregnancy just to, I guess relate my symptoms with theirs. But it was, I never found anyone with the information that I needed. So this video is dedicated to all the women who are currently experiencing ectopic pregnancies, again, who have recently been diagnosed with ectopic pregnancy. Now, let's go on to the first symptom. Now, the first symptom that I had when I was pregnant with my ectopic pregnancy was cramping. Now, I had excruciating lower back cramping, and it was like period-like crampings. Now, it was very, very, very strong cramping, of course. Now, you also want to keep in mind that a lot of the women, when they are first pregnant, they also get similar cramping. But, yeah, I had a lot of cramping. Now, as far as, for intrauterine pregnancies, whenever you have the cramping, it's usually an indication that the uterus is stretching out, okay, preparing for the baby. Now, in my case, of course, ectopic related. My cramping was horrible. Now, the second symptom that I had was spotting. I had 1 month of spotting. Yeah, so I had been bleeding for a whole month. Now, in between that spotting, I did have heavy clotted bleeding. And, it was very, very, very heavy. And, of course, during that period of time when it was happening, I would call my doctor just to, make sure that, that was normal with the process. And they would tell me, oh, yeah, it's normal. Well, that's what they would tell me. But, yeah, so the bleeding, again, I'm going to go into detail with that. As far as the bleeding goes, my bleeding, the vaginal discharge, was dark brown. So the spotting was dark brown. Now then, when I had the heavy clotted bleeding, of course, it would be a very, very dark red. So yeah, so the spotting was extremely dark in color. It was a dark brown. Again, you want to make sure, for those of you who are going through ectopics, that the bleeding is not too heavy. If it is, call your doctor right away. But anywho, you want to do so because when you lose a lot of blood, you lose iron, okay? And if you are iron deficient, then, that can lead to anemia. So, you want to make sure you let your doctors know if there's any heavy bleeding that's been persisting for days. A lot of the women who have healthy pregnancies, who have healthy intrauterine pregnancies, do have what is called implantation bleeding in their early trimester, I guess you could say. So, the 2 weeks after conception, when the embryo burrows completely into the endometrium lining, because they're burrowing in, they're pressing in, right? So that bleeding that's being released has to go out through your vagina. So a lot of women do experience the normal implantation bleeding. But in ectopic pregnancy, of course, you want to make sure that you let your doctor know if it's the color of the discharge, how much, you're losing. I remember calling my doctor and letting him know of my, of the bleeding that was going on, and he told me, well, if you are having to change your pad every hour, you definitely want to, come in, we'll go ahead and see what we have to do. But luckily I didn't have to do that, but it was very, very heavy. Now, the third symptom that I had was throbbing shoulder pain. Now, I also asked my doctor about this, and he's like, well, yeah, that's usually an indication of an ectopic pregnancy. When you have shoulder pain, you definitely want to let your doctor know. Now, if you haven't gotten diagnosed with an ectopic pregnancy and you're thinking, definitely watch out for that. You'll all of a sudden get like a very, very throbbing pain in your shoulder. That's usually an indication, and doctors can also tell you. Well, my doctor told me that, it's an indication of an ectopic pregnancy. So you want to make sure that you watch out for that. The shoulder pain, okay? It's like a throbbing, it's like all of a sudden you get like a throbbing shoulder pain. Watch out for that. Now, the fourth symptom that I had was dizziness. Yeah, so I remember taking a bath, and while I was getting up, all of a sudden, like for 3 seconds, I was like blacking out. All of a sudden, I tried to keep my balance and, took a deep breath and it went away. But yeah, dizziness is also a symptom of an ectopic pregnancy. Of course, a lot of women experience that in their, in a successful intrauterine pregnancy, but in an ectopic pregnancy, usually they tell you that's a symptom, dizziness, or, fainting, something like that. But that was one of the symptoms I had as well. Let your doctor know as well if you're having dizziness. Okay, so those are all the symptoms I had with my ectopic pregnancy. Now, the aftermath, after you've been diagnosed, after you've been treated, you definitely, depending, like my case, like I said, I was administered a methotrexate shot to dissolve the growing cells of the embryo. But it breaks my heart when I say it, but yeah. So I was administered a methotrexate, and after that, like the first day, the levels did go up, but then it drastically, like not drastically, kind of, yeah, it went down, and so it has to continue. It has to continue to fall. Now, if it doesn't fall the way they want it to, then they have to take other measures. But in my case, it took 1 shot of methotrexate. Now, you definitely, for those of you who are currently going through the your treatment, like I guess if you've had this administered or whatnot, I don't know what treatment you guys are having, you definitely want to monitor your HCG beta levels. Now, the HCG, remember, that's your pregnancy hormone. That's the hormone that detects pregnancy. Definitely follow up. If your doctors are telling you, okay, now each week you have to go ahead and go, get blood drawn, and we have to check your HCG beta levels to make sure they're going down, definitely do it. Now, some of you are going to be, stressed out a little because it's taking a little too long. Don't worry, I went through it. It took me 3 months. Yeah, guys, it took 3 months for my HCG beta levels to drop down to 0 and for me to technically not be pregnant anymore. So yeah, like I said, every woman is different. Every physical body is different, so your body will react differently. Some women, it takes 2 weeks. Some women, it takes 2 months. In my case, it took 3 months, but definitely get that HCG beta level monitored until it drops down to 0. Okay. Also, as soon as you find out after, you've been through an ectopic, usually doctors recommend you wait some time because you definitely want to heal physically and emotionally. Because I got 1 shot of methotrexate, doctors recommended me to give it 3 months, right? That's what they did. That's what they recommended me. So I had my methotrexate administered in February, March, April, May. So yeah, it's been 4 months since. So, but I'm not ready yet. I can't wait to try again. But I think waiting for me is the best bet at this time. I just want to heal again, emotionally and physically. But yeah, so as soon as excuse me. For those of you that have been through an ectopic you know, maybe a month or 2 months or 3 months. Usually they tell you to wait 3 months, but if it happens sooner, you definitely want to let your doctor know, and you definitely want to get an early scan, because we've had ectopic pregnancies, and they, you know, the doctors will tell you this. I mean, my doctor told me this is, you know, as soon as you find out that you're pregnant again, call me and let's set up an early scan, because you've been through an ectopic once. It's, you know, you have better chances of going through it again. But yeah, definitely, you want to fight for that early scan. Okay. So yeah, those were my symptoms and my recommendations to you guys. For those of you who are currently experiencing an ectopic pregnancy, my prayers go out to all of you. And remember, you are not alone. God's with you, I'm with you, and the Trying to Conceive community is with you. You know, it's hard, and I know how hard it is. Just know that, you know, you are not alone, and that, again, God does things for reasons, and that, you know, your future, only God knows what your future holds, but I'm most definite, and, you know, when you have hope, that BFP will come again, and it will be a successful pregnancy. But yes, my prayers go out to every one of you. I know how it is, and I know how it feels. It's hard, but God will help you through this, and we will help you through this. So, alright guys, hope my video will help some of you guys, and I will talk to you guys later. And do remember to rate and subscribe. Bye!